I'm Princess, and today I am going to substantiate or answer the pharmacological facts about pharmacokinetics. Bioavailability of drug after oral dosing is incomplete.
Orally administered drugs must pass through the intestinal wall and then the portal circulation to the liver. Both are common sites of first-pass metabolism or metabolism that occurs before a drug reaches systematic circulation. Thus, many drugs may be metabolized before adequate plasma concentrations are reached. Low bioavailability is common with oral dosage forms of poorly water-soluble, slowly absorbed drugs. If the drug does not dissolve readily or cannot penetrate the epithelial membrane, or example, if it is highly ionized and polar, time at the absorption site may be insufficient. In such cases, bioavailability tends to be highly variable as well as low.